The needle went in at the fifth intercostal space, angled upward toward the colonel's heart. 40 milliliters of dark blood filled the syringe. The monitor screamed, then beeped once, twice, steady. Colonel James Bridger gasped, and his eyes opened. 14 minutes after his heart stopped, he was alive. For stories like this, subscribe. 6 hours earlier, the automatic doors of Fort Carson Medical Center slid open at 1:47 p.m. on a Tuesday afternoon. Samantha Reed walked through them wearing navy scrubs that fit slightly loose at the shoulders. She carried no bag, just a stainless steel travel mug and her hospital ID clipped to her hip. Her auburn hair was pulled back tight, and when she signed in at the nurse's station, her handwriting was small and precise. The trauma bay hummed with the usual afternoon rhythm. Monitors beeped in steady intervals. Someone laughed near the supply closet. The air smelled like antiseptic and reheated coffee. Dr. Marcus Holloway stood near the surgical board, reviewing the day's schedule with 2 residents. He was 52, gray at the temples, and carried himself like someone who had never been questioned. When Sam passed behind him to grab a patient chart, he glanced over his shoulder. "Nurse Reed." She stopped. "Coffee station is that direction." He pointed toward the break room without looking at her. The 2 residents smirked. Sam held his gaze for 1 second, then nodded and moved toward the prep area. No words, no expression. Dr. Lynn Patterson, a senior resident with shark eyes and tired posture, watched the exchange from across the room. She said nothing, but her pen stopped moving on her clipboard. At 2:15 p.m., Sam was assigned to assist in OR3, routine appendectomy, 31-year-old male, mild fever, elevated white count, textbook case. Holloway would be lead surgeon. Sam prepped the instruments in silence, arranging them by size and sequence. Her hands moved without hesitation. The patient was prepped and draped by 2:35 p.m. Holloway entered, gloved and confident. He nodded to the anesthesiologist and made the first incision. Sam handed him the scalpel without being asked. Then the retractor. Then suction. Holloway paused. "How did you know I needed suction?" "Standard progression, doctor." He grunted and continued. But as he worked deeper, Sam's eyes moved across the exposed tissue. The color was slightly off, pale yellow where it should be pink. And there was a smell, faint but distinct, like spoiled meat buried under cleaning solution. She glanced at the monitor. Vitals stable, blood pressure normal, temperature elevated but not critical. Holloway continued dissecting. Sam inhaled slowly. "Doctor." He didn't look up. "The tissue discoloration near the cecum, and the smell. I think we should consider expanding imaging before we proceed." Holloway's hand stopped. He looked at her over his mask. "Excuse me?" "There might be early peritonitis, if the appendix ruptured even partially." "Nurse Reed." His voice was calm but edged. "I have been performing abdominal surgeries for 20 years. The appendix is inflamed but intact. Vitals are stable. Your job is to hand me instruments, not to diagnose." One of the residents coughed into his mask. Sam held the suction catheter steady. "Understood." Holloway resumed. But 30 seconds later, as he retracted the appendix, a pocket of purulent fluid drained into the cavity. The smell intensified. His hands hesitated. Sam's left hand was already reaching for irrigation before he called for it. "Irrigation." She handed it to him. "Suction." Already in her right hand. Holloway worked faster now, his calm veneer cracking slightly. The infection had spread further than the initial scan suggested. The surgery shifted from routine to complex. He called for a larger retractor. Sam handed him a small Richardson. "I said large." "Small first, doctor. Less tissue trauma for visualization." He stared at her, then took it. And she was right. The smaller instrument gave him the angle he needed. Dr. Patterson leaned closer to the surgical field, watching Sam's hands. The way she anticipated. The way her fingers never fumbled. "Those sutures," Patterson murmured to the other resident, "those are interrupted tension sutures, military style." The resident squinted. "How do you know?" "My brother was an Army medic." 43 minutes into what should have been a 60-minute procedure, Holloway began closing. Sam had already threaded the needle. He glanced at her, said nothing, and took it. By 3:29 p.m., the patient was in recovery. Prognosis excellent. 0 complications. Holloway stripped off his gloves and tossed them into the bin. He looked at Sam for a long moment. Lucky instinct. She met his eyes. Training. Don't expect praise for doing your job. I don't. He left the OR. The residents followed. Patterson lingered, looking at Sam. Where did you train? Sam cleaned the instrument tray, her hands steady and methodical. That's not an answer. Sam glanced up. Her green eyes were calm, unreadable. It's the one I have. Patterson nodded slowly, then walked out. Alone in the OR, Sam stood at the scrub sink and washed her hands. The water ran hot. She stared at her reflection in the steel faucet, distorted and small. Her right forearm bore a thin surgical scar, pale against her skin. She rolled her sleeve down and dried her hands. At 4:10 p.m., she was back at the nurse's station, logging post-op notes. Her handwriting was the same. Small, precise, no wasted motion. If you want to see how Sam's refusal to follow protocol gets her fired, and how that same refusal saves a colonel's life 2 hours later, make sure you subscribe to Emergency Hero Stories. Because what happens? Next, we'll leave you speechless. Where are you watching from? The break room smelled like burnt coffee and microwaved leftovers. 3 residents sat around a small table near the window, their voices low but audible. Dr. Patterson leaned against the counter, stirring sugar into her cup. Sam entered quietly, heading for the water dispenser. I'm telling you, she knew exactly what was coming, one of the residents said. His name was Garrett, second year, always eager to impress Holloway. She had irrigation ready before he even saw the abscess. Maybe she got lucky, another resident offered. A woman named Kim, first year, still learning to hide her uncertainty. Nobody gets that lucky, Patterson said without turning around. She was reading the tissue. That's not luck. Garrett leaned back in his chair. Come on, Lynn. She's a nurse. Probably been watching surgical videos online. You can learn anything on YouTube now. Patterson turned, holding her coffee. You don't learn to suture like that from videos. Kim glanced toward Sam, who was filling her mug at the dispenser, her back to them. She lowered her voice anyway. You think she worked somewhere else before here? Somewhere serious? I think, Patterson said slowly, that she's overqualified for this job, and I think Holloway knows it, and that's why he doesn't like her. Garrett scoffed. Or maybe he just doesn't like nurses who think they can diagnose. Sam finished filling her mug and walked out without looking at them. The door swung shut behind her. The room went quiet for a beat. Did she hear us? Kim asked. Patterson sipped her coffee. Probably, and I don't think she cares. At 4:47 p.m., Sam was called back to the surgical floor. Holloway had another case scheduled, and the assigned nurse had called in sick. Sam was the replacement. She walked into the pre-op area where Holloway stood reviewing scans with 2 surgical techs. One of them was Sergeant Maya Torres, 26, former Army medic, now working as a civilian tech while finishing her undergraduate degree. Holloway glanced at Sam. Nurse Reed, you'll assist on this one too. Understood. He gestured toward the scans on the monitor. Gallbladder removal, routine cholecystectomy. Patient is 54, history of gallstones, no prior surgeries. Should be straightforward. Sam nodded and moved to prep the instrument tray. Torres worked beside her, organizing sutures and drapes. She watched Sam's hands as she arranged the tools. Scalpel, forceps, retractors, clamps. Everything in sequence, everything precise. Torres spoke quietly. You were in OR 3 earlier, right? The appendectomy that turned complicated? Yes. Garrett said you called the abscess before Holloway saw it. Sam didn't look up. I suggested expanded imaging. He didn't take the suggestion. Torres smiled slightly. But you were right. Sam glanced at her. Doesn't matter if I'm right. Matters if the patient walks out. Torres paused, then nodded. Fair. They worked in silence for another minute. Then Torres leaned closer, her voice barely audible. Those interrupted sutures you used to close earlier, I've seen those before. Sam's hands didn't stop moving. They're standard. No, Torres said quietly. They're military standard. I used them in Kandahar. Sam met her eyes for half a second, then returned to the tray. Lots of techniques overlap. Torres didn't push, but she didn't look away either. The patient was brought in at 5:15 p.m. Holloway entered gloved and ready. The anesthesiologist confirmed sedation, and Holloway made the first incision. Laparoscopic approach, small, clean, minimally invasive. Sam handed him the instruments in perfect order: trocar, camera, grasper. Holloway worked efficiently, his confidence restored after the earlier case. He located the gallbladder and began dissecting it free from the liver. Everything progressed smoothly, no complications, no surprises. But as he retracted the surrounding tissue, Sam noticed a slight irregularity in the bile duct, a small bulge barely visible on the monitor. She leaned forward slightly, studying the screen. Holloway continued dissecting. Sam's voice was calm. "Doctor, the common bile duct, there's a dilation near the junction." Holloway didn't pause. "Vitals are stable, gallbladder is clear." "I understand, but if there's a stone lodged in the duct?" "Nurse Reed." He looked up from the scope, his tone measured but firm. "I can see the field, there is no obstruction. The duct is patent." "With respect, doctor, the dilation suggests—" "Enough." The word cut through the room. Holloway straightened slightly, still holding the grasper. "I appreciate your enthusiasm, but this is not a teaching moment. This is my operating room. You assist, you do not diagnose. You do not question my clinical judgment in front of my team. Are we clear?" The room went silent. The only sounds were the hum of the monitors and the rhythmic beep of the patient's heartbeat. Sam's jaw tightened, barely perceptible. "Clear. Good." Holloway returned to the scope. He continued dissecting. 30 seconds later, as he clamped the cystic duct, a small stone dislodged and tumbled into view on the monitor. It had been hidden behind the gallbladder wall, exactly where Sam had indicated. Holloway froze. Torres glanced at Sam. Sam's face showed nothing. Holloway cleared his throat. "Retrieve the stone." He said it to no one in particular. Sam handed him the grasper without a word. He extracted the stone, dropped it into a specimen cup, and finished the procedure in silence. The surgery concluded at 6:02 p.m. Patient stable, no complications. Holloway stripped off his gloves and walked out without speaking. The residents followed. Torres stayed behind, helping Sam clean the instruments. "You saw that stone before he did." Sam wiped down the tray. "Doesn't matter." "It does if it could have caused a post-op blockage." Sam looked at her. "He got it out. Patient's fine. That's what matters." Torres dried her hands. "You don't get angry, do you?" "Getting angry doesn't save lives." Torres smiled faintly. "No, but it makes you human." Sam picked up the tray and carried it toward the sterilization room. "I'm human enough." At 6:20 p.m., Sam stood in the hallway outside the surgical wing, drinking water from a paper cup. Her shift technically ended at 7, but she never left early. Dr. Patterson walked past, then stopped. "Reed?" Sam turned. "You were right. Again." "Doesn't feel like it." Patterson stepped closer, lowering her voice. "Holloway's not a bad surgeon. He's just territorial. He came up in a different era. Nurses stayed in their lane. Doctors made the calls. He doesn't know how to handle someone like you. Someone like me. Someone who sees things he misses." Sam crumpled the paper cup. "I'm not trying to make him look bad. I know, but you are anyway, and that's the problem." Patterson walked away. Sam stood alone in the hallway, the fluorescent lights buzzing faintly overhead. She looked down at her hands. Steady, calm, no tremor. She rolled her sleeve up slightly, exposing the scar on her forearm. A thin line, precise, surgical. She traced it with her thumb, then pulled the sleeve back down. At 6:38 p.m., the hospital intercom crackled to life. "Trauma alert, multiple casualties, all available personnel to the emergency department. Repeat, trauma alert." Sam's head lifted. She dropped the cup into the trash and started walking, fast. The emergency department erupted into controlled chaos. Nurses sprinted toward supply carts. Residents pulled on trauma gowns. The double doors leading to the ambulance bay swung open, and the sound of sirens filled the air. Sam reached the trauma bay at 6:41 p.m. Dr. Holloway was already there, barking orders to a cluster of residents. His voice cut through the noise. "Kim, you take bed 3. Garrett, bed 4. Patterson, you're with me on bed 1. He saw Sam and pointed. "Reed, bed 2. Stable patient. Monitor vitals and keep them calm until we can get to them. Sam nodded and moved toward the second trauma bed. A paramedic was already wheeling in the first stretcher, a woman in her 40s, conscious but pale, holding her arm at an awkward angle. Fractured radius, maybe ulna. Painful but not life-threatening. Sam positioned herself at the bedside, checking the monitor. Blood pressure slightly elevated, heart rate 110, respiratory rate normal. The woman's eyes were wide, darting around the room. "Ma'am, I'm Sam. I'm going to stay with you. You're safe." The woman nodded, her breathing shallow and quick. "My arm, it hurts so much." "I know. We're going to take care of you." Sam glanced toward bed 1. A man in his 60s, unconscious, covered in blood. Holloway and Patterson worked over him, calling for instruments, starting lines. The monitor above his bed beeped erratically. 2 more stretchers came through the doors. Paramedics shouted vitals. A teenage boy with a head laceration, an older man with chest trauma. The noise escalated. Orders overlapped. Someone called for more O-negative blood. Sam stayed focused on her patient, inserting an IV line with one smooth motion. The woman flinched but didn't cry out. Sam taped the line down and adjusted the drip. "You're doing great," Sam said quietly. Then she heard it, a faint whistling sound from bed 1. Wet, rhythmic, out of sync with the man's breathing. She turned her head slightly, listening. Holloway was calling for a chest tube. Patterson was cutting away the man's shirt. The paramedic who brought him in stood nearby, relaying information. Found him pinned under the dashboard. Steering column crushed his chest. Breath sounds diminished on the left side. Holloway palpated the man's ribs. Probable pneumothorax. Get me a tube kit. But the whistling continued. Sam's eyes narrowed. That sound wasn't coming from the lungs. It was higher, sharper. She took 2 steps toward bed 1, her patient momentarily stable. "Doctor." Holloway didn't look up. "Not now, Reed." "The sound. It's not pulmonary. It's tracheal." "I said not now." Patterson glanced at Sam, then back at the patient. The man's oxygen saturation was dropping. 92, 90, 88. Sam moved closer. "Doctor, his airway is compromised. The whistling means there's a partial obstruction. If you place a chest tube without securing the airway first." Holloway's head snapped up. "Nurse Reed, return to your patient. Now." Sam didn't move. "He's going to code. He has a collapsed lung. I am treating a collapsed lung. He has a fractured trachea." Holloway straightened. His face flushed. "You are a nurse. You do not make those calls." The man's oxygen saturation hit 85. The monitor alarm screamed. Patterson's eyes darted between Holloway and Sam. "Marcus, maybe we should. I am the attending physician. This is my patient." Sam looked at the monitor. 83. The man's lips were turning blue. She stepped forward. "Then you're killing him." The room went silent. Everyone within earshot stopped. Holloway's face went white, then red. "Get out. Doctor, you are done. Leave this trauma bay immediately or I will have security remove you." Sam held his gaze. The man's saturation hit 80. The alarm wailed. Patterson's voice was quiet but urgent. "Marcus, he's crashing." Holloway turned back to the patient, his hands shaking slightly. He reached for the intubation kit, but the whistling had stopped. The man's chest wasn't rising. "Damn it, he's not moving air." Patterson grabbed the bag valve mask. "I can't ventilate. There's a blockage." Holloway's confidence cracked. "Prepare for cricothyrotomy." He called for a scalpel. His hands fumbled with the tray. Precious seconds ticked by. The man's saturation dropped to 76. Sam moved. She didn't ask. She didn't speak. She took the scalpel from the tray, stepped to the head of the bed, and palpated the man's neck. Her fingers found the cricothyroid membrane in one motion. She made a horizontal incision, half an inch long, controlled and precise. Holloway shouted, "Reed, stop!" She inserted a bougie dilator, widened the opening, and slid a tracheostomy tube into place. The entire sequence took 11 seconds. Air rushed into the man's lungs. The monitor beeped. Oxygen saturation began to climb. 78, 81, 85. Sam stepped back, the scalpel still in her gloved hand. Blood streaked her forearm. The room was frozen. The man's chest rose and fell. The color returned to his face. His saturation hit 92. Patterson stared. Jesus! Holloway's mouth opened, but no sound came out. He looked at the man, then at Sam, then at the scalpel in her hand. Torres stood near the supply cart, her eyes wide. I've seen that technique. That's a field expedient airway, military. Holloway found his voice. You just performed surgery without authorization. You violated protocol. Sam placed the scalpel on the tray. He's breathing. That is not the point. Then what is? Holloway's hands clenched into fists. You are suspended, effective immediately. Leave the building. Patterson stepped forward. Marcus, she saved his life. She violated direct orders from an attending physician. She performed a surgical procedure without credentials. Sam pulled off her gloves and dropped them into the biohazard bin. Her face was calm, her hands steady. Understood. She turned and walked toward the exit. The automatic doors slid open. She stepped through them into the hallway. Behind her, the man's oxygen saturation hit 98. His heart rate stabilized. The monitor beeped in steady rhythm. Torres watched her go. She knew exactly what to do. No hesitation. Patterson looked at Holloway. Who is she? Holloway didn't answer. He was staring at the patient, whose chest rose and fell in perfect rhythm, alive, because of what Sam had done. Garrett checked his watch. That airway took less than 15 seconds. I've never seen anything that fast. Kim whispered. That wasn't luck. Patterson pulled out her phone and stepped into the hallway. She opened the hospital staff directory and searched for Samantha Reed. The profile was minimal. Hire date 18 months ago. Nursing license current. Previous employment listed as blank. She switched to a search engine and typed the name with military and medical keywords. Nothing. She tried again. Captain Samantha Reed, Army Medical Corps. The screen loaded. A single result. A news article from 2 years ago. Headline: Army surgeon under investigation following Kandahar incident. Patterson's eyes widened. She clicked the link. The article was brief, details redacted, but the name was there. Captain Samantha Reed, MD. 8 years of service, multiple commendations, special operations trauma surgeon. Patterson looked up. Sam was gone. The hallway was empty. She walked back into the trauma bay. Holloway was finishing the chest tube placement on the patient Sam had saved. The man was stable now, fully oxygenated, no distress. Patterson approached quietly. Marcus, we need to talk. Not now. She's not just a nurse. Holloway didn't look up. I don't care what she is. She's fired. She's a doctor, a military trauma surgeon. Holloway's hands stopped. He turned slowly. What did you say? Captain Samantha Reed, Army Medical Corps, 8 years, special operations. The room went quiet again. Everyone was listening now. Holloway's face drained of color. That's impossible. Patterson held up her phone, showing him the article. It's not. Holloway stared at the screen. His jaw worked, but no words came. He looked at the patient, at the perfect airway Sam had created, at the man breathing easily because she had refused to follow his orders. Torres spoke quietly. She wasn't guessing. She's done this before. A lot. Holloway pulled off his gloves. His hands were shaking now. Why is a military surgeon working as a nurse? No one answered. Outside, Sam stood in the parking lot, the evening air cool against her face. She looked at her hands. Still steady, still calm. She closed her eyes and breathed. Sam stood in the parking lot, her back to the hospital. The sky had turned amber, streaked with purple clouds. Her breath formed a faint mist in the cooling air. She rolled her shoulders once, then started walking toward her car. Behind her, the automatic doors burst open. Reed, wait! She stopped but didn't turn. Dr. Patterson jogged toward her, still wearing her trauma gown, stethoscope swinging from her neck. You can't just leave. I was told to leave. Patterson came around to face her. I know who you are. Sam's expression didn't change. Then you know why I'm here, and why I'm leaving. Captain Samantha Reed, Army Medical Corps, Special Operations Trauma Surgeon, 8 years of service. Why are you working as a nurse? Sam looked past her, toward the hospital. Because I wanted to stop making decisions that get people killed. Patterson studied her face. Kandahar? Sam's jaw tightened. You read the article. Enough of it. The rest was redacted. Then you know enough. Sam turned toward her car again. Patterson grabbed her arm gently. That man in the air is alive because of you. You made the right call. Holloway doesn't think so. Holloway is wrong. Sam pulled her arm free, not harshly, just firmly. Doesn't matter. I'm done. She walked 3 steps before the hospital intercom echoed through the open doors behind them. Trauma alert, mass casualty incident, multiple vehicles, all available surgical staff report immediately. Repeat, mass casualty incident. Patterson's head snapped toward the building. Sam stopped. The intercom continued. ETA 4 minutes. At least 8 patients. 3 critical. Patterson looked back at Sam. We need you. I'm suspended. I don't care. Sam shook her head. I can't. Patterson stepped closer, her voice urgent. People are going to die if we don't have enough hands. You know that. You've done this before. Sam stared at the pavement, her hands curled into fists, then relaxed. It's not my place anymore. Then make it your place. The wail of sirens rose in the distance, growing louder. Patterson turned and sprinted back toward the entrance. Sam stood alone in the parking lot, the sound of approaching ambulances filling the air. She closed her eyes, breathed in, breathed out. Then she ran. She caught up to Patterson at the trauma bay doors. Inside, the organized chaos had returned. Nurses prepped beds, residents pulled on gloves. Holloway stood at the center, assigning positions. Patterson, bed 1. Garrett, bed 2. Kim, bed 3. Torres, float between them. He saw Sam enter and his face hardened. You were told to leave. You need hands. I have them. You're suspended. Then suspend me after. Right now, you have 8 patients coming and not enough staff. Holloway opened his mouth to respond, but the first ambulance screeched to a stop outside. The bay doors flew open. A paramedic shouted as they wheeled in the first stretcher. Male, mid-30s, chest trauma, BP 90/60, pulse 120. Another stretcher followed immediately. Female, late 20s, head injury, GCS 10, possible skull fracture. Then another. Male, early 60s, abdominal trauma, distended abdomen, probable internal bleeding. Holloway's eyes darted between the incoming patients and Sam. He made a decision. Bed 4, least critical. Touch nothing without my approval. Sam moved to bed 4 without a word. A young man, maybe 22, conscious but pale, lacerations across his arms and face, breathing rapid but steady. She began her assessment, hands moving efficiently. Airway clear, breathing adequate, circulation stable, bleeding superficial. She glanced toward bed 1, the man with chest trauma. His breathing was labored. Holloway was listening with a stethoscope, his face tense. Bed 2, the woman with the head injury. Kim was struggling to get a clear response. Blood matted her hair. Bed 3, the older man. Patterson had cut away his shirt. His abdomen was rigid, distended. She called for an ultrasound. 2 more stretchers arrived. Female, 50s, multiple fractures, stable for now. Male, teens, penetrating trauma to the thigh, arterial bleed controlled in the field. Holloway pointed without looking. Beds 5 and 6, Torres triaged them. Torres moved fast, assessing both patients simultaneously. Her hands were steady, her voice calm. She called out vitals, established IV lines, applied pressure dressings. Sam finished bandaging her patient's lacerations. He would need stitches, but he could wait. She looked around the room. Everyone was occupied. The noise level was rising. Monitors beeped in overlapping rhythms. Then the last 2 stretchers came through. The paramedic's voice was strained. 2 more from the same vehicle, driver and passenger, both critical. The first stretcher held a woman in her 40s, unconscious, shallow breathing. The paramedic rattled off details. Suspected flail chest, paradoxical breathing, oxygen sat 88 and dropping. The second stretcher carried a man in military dress uniform, silver eagles on his shoulders, colonel's insignia. His face was ashen, eyes closed. The paramedic continued. Colonel James Bridger, age 58, was getting a routine physical when the accident happened outside. Witnessed the impact, tried to help. Collapsed suddenly. No pulse on scene. CPR initiated. We got a pulse back briefly, but he's unstable. Possible cardiac event. Holloway pointed to bed 7 for the woman, bed 8 for the colonel. But all the residents were occupied. Patterson was wrist deep in the abdominal trauma. Kim was intubating the head injury. Garrett was controlling the arterial bleed. Torres ran to bed 7, starting an assessment on the woman with flail chest. Holloway moved toward bed 8, the colonel. He placed his stethoscope on the man's chest. Listened, his face went pale. Muffled heart sounds, distended neck veins. BP is 70/40. He looked up. Possible cardiac tamponade. Patterson glanced over. Can you handle it alone? I'll have to. Sam's patient was stable. She stepped toward bed 8. Doctor. Holloway didn't look at her. Stay where you are. You need another set of hands. I said stay. Sam ignored him. She moved to the opposite side of the bed, checking the monitor. heart rate 140, blood pressure dropping, oxygen saturation 84. Holloway began palpating the colonel's chest. His movements were precise but hesitant. Cardiac tamponade required pericardiocentesis, a needle inserted into the sac around the heart to drain excess fluid. High risk, high reward. Get me an echo, Holloway said. Torres ran to grab the portable ultrasound. She wheeled it over, and Holloway pressed the probe against the colonel's chest. The screen showed a dark shadow around the heart. Fluid. Confirmed. Tamponade. Called for a pericardiocentosis kit. A nurse brought it over. Holloway opened the sterile package, his hands moving slower than usual. Sam watched the monitor. Blood pressure, 65/35. The colonel's face was gray. Holloway positioned the needle, angling it toward the heart. His hand trembled slightly. Sam's voice was quiet. 5th intercostal space, sub-xiphoid approach is safer. Holloway's jaw clenched. I know the anatomy. He inserted the needle. Too steep. The monitor screeched. The colonel's heart rate spiked, then dropped. Holloway pulled the needle back, sweat forming on his forehead. Damn it. He tried again. Same angle, same result. The heart rate plummeted. Sam stepped closer. Doctor, let me... No. You're going in too steep. The angle needs to be... I said no. The monitor flatlined. The alarm wailed. The colonel's chest stopped moving. Holloway froze. Patterson's voice cut through the chaos. Marcus, he's coding. Holloway stared at the monitor. His hands hovered over the needle. Sam didn't wait. She reached for the kit. Holloway blocked her. You are not authorized. He's dying. Step back or I will have you arrested. Sam met his eyes. The room seemed to shrink. The noise faded. It was just the two of them and the silent monitor. Sam's voice was steady. Then arrest me after I save his life. She pushed past him, took the needle, and positioned herself at the colonel's side. Her hands didn't shake. Her eyes were calm. Holloway shouted, Security! Someone get security in here now! But no one moved. Every eye in the trauma bay was on Sam. Torres stood frozen. Patterson stopped mid-suture. Even the monitors seemed to hold their breath. Sam placed her fingers on the colonel's chest, found the landmark, 5th intercostal space, just left of the sternum. She angled the needle upward, 30 degrees, toward the left shoulder, and she pushed. The needle went in smooth. Sam's hand was steady, her angle precise. She advanced slowly, feeling the resistance of tissue, then the sudden give as the tip entered the pericardial sac. Dark blood filled the syringe. 10 milliliters, 20, 30. The pressure around the colonel's heart released. The monitor stayed silent. Holloway's voice was hoarse. It's too late. He's been down for 8 minutes. Sam didn't respond. She withdrew the needle carefully, handed it to Torres without looking, and placed both hands on the colonel's chest. She began compressions. Hard, fast, precise. Someone bag him, she said. Torres grabbed the bag valve mask and positioned herself at the head of the bed. She squeezed the bag in rhythm with Sam's compressions. Air flowed into the colonel's lungs. His chest rose and fell. Sam counted silently. 30 compressions. She paused. Torres delivered 2 breaths. Sam resumed compressions. Holloway stood frozen, his face pale. The protocol says after 10 minutes without circulation. I don't care what the protocol says. Sam's voice was calm but absolute. Her hands pressed down in perfect rhythm. The bed shook slightly with each compression. Patterson moved closer, watching. Her technique is flawless. Look at the depth, the rate. Garrett whispered, She's done this 1,000 times. 2 minutes passed. The monitor remained flatlined. Sam's breathing was controlled. No strain, no hesitation, just rhythm. Torres looked at the clock on the wall. 10 minutes. Holloway reached toward Sam's shoulder. Reed, it's over. You did everything you could. Sam didn't stop. Not yet. He's gone. No. Holloway's hand hovered above her shoulder, then dropped. You can't bring everyone back. Sam's eyes stayed on the colonel's face. Her hands kept moving. I can try. Another minute passed. 11 minutes total. The room was silent except for the sound of compressions and the rhythmic hiss of the bag valve mask. Kim's voice was barely audible. This is impossible. Patterson didn't take her eyes off Sam. She doesn't think so. 12 minutes. Sam's arms should have been exhausted. Her shoulders should have burned. But her compressions didn't slow, didn't weaken. Each one delivered exactly the right force, exactly the right depth.
Torres watched her face. No sweat, no panic, just focus. "Where did you learn to do this?" Torres whispered. Sam didn't answer. 13 minutes. Holloway stepped back, his hands at his sides. "I've never seen anyone continue this long." Patterson's voice was quiet. "Because most people give up. Because most people are realistic. Or most people don't have her training." 14 minutes. Sam paused compressions. Torres delivered 2 breaths. Sam placed her fingers on the colonel's carotid artery, checked for a pulse. Nothing. She resumed compressions. Holloway's voice cracked. "Sam, please, he's not coming back." It was the first time he'd called her by her first name. Sam's jaw tightened. She pressed down harder, faster. "Come on, Colonel, not today." Her voice was low, firm, almost a command. 15 compressions, 20, 25. Then the monitor beeped, once. Everyone's head snapped toward the screen. It beeped again. A blip appeared. Weak, irregular, but there. Torres gasped. "I've got a pulse." Sam stopped compressions and checked the carotid artery herself, a faint throb beneath her fingers. "Pulse is thready. Let's get him on pressors. Start an epinephrine drip." She spoke with absolute authority, no hesitation, no question in her voice. A nurse ran to prepare the medication. Sam adjusted the colonel's head position, ensuring his airway stayed open. Torres continued bagging him, delivering oxygen with each squeeze. The monitor beeped again. The rhythm was chaotic, but it was there. The colonel's chest began to rise
On its own. Shallow breaths. Weak, but spontaneous. Patterson moved closer, staring at the monitor. "His heart is beating." Garrett's voice was filled with disbelief. 14 minutes. He was down for 14 minutes. Holloway stood motionless, his face ashen. He looked at Sam, then at the colonel, then back at Sam. "How did you?" Sam didn't look at him. She was checking pupil response, assessing neurological function. The colonel's pupils reacted sluggishly to light, a good sign. "He needs a CT scan, head and chest, and get cardiology down here now." She gave the orders as if she'd never stopped being a doctor, as if the last 18 months had never happened. Torres stared at her. "You're not a nurse." Sam met her eyes. "No. You're a surgeon." "I was." "You still are." Sam turned back to the colonel. His color was improving, the grayness fading, his oxygen saturation climbed slowly. 86, 89, 92. Holloway found his voice. "You just performed a pericardiocentesis and 14 minutes of CPR on a patient I declared hopeless. You brought him back from the dead." Sam checked the IV line, adjusted the flow rate. He wasn't dead. His heart just needed help remembering how to beat. That's not how medicine works. Sam finally looked at him. Her green eyes were calm but intense. That's how battlefield medicine works. The room went silent again. The weight of her words settled over everyone. Patterson stepped forward. "You've done this before. How many times?" Sam didn't answer immediately. She watched the colonel's chest rise and fall on its own now, steady, strong. Enough times to know when to stop, and when not to. Torres's voice was soft. "Kandahar?" Sam's hands paused for a fraction of a second. Then she resumed adjusting the monitor leads. "Among other places." Holloway pulled off his gloves slowly. His hands were shaking. "I don't understand. If you're a trauma surgeon, why are you working as a nurse? Why are you here?" Sam's jaw tightened. "Because I got tired of playing God." "You just did it again." "No, I just refused to give up." The colonel's eyes fluttered. His lips moved slightly. No sound came out, but the movement was there. Consciousness returning. A nurse called out, "Cardiology is on the way. CT is ready." Sam stepped back from the bed, peeling off her gloves. "He's stable. You can take it from here." Holloway stared at her. "You can't just walk away." "You told me to leave. I'm leaving." "That was before." "Before what? Before you saw me do the job you wouldn't let me do in the first place?" Holloway's mouth opened, then closed. He had no response. Patterson moved between them. "Sam, wait. We need to talk." "No, we don't." Sam turned toward the exit. Torres called after her. "Captain Reed." Sam stopped. Her shoulders tensed. "I saw the way you worked. I've seen that before. Forward operating bases, field hospitals. You were special operations, weren't you? Sam didn't turn around. I was a lot of things. Why did you leave? Sam's voice was quiet. Because I made a choice that got people killed, and I couldn't live with that anymore. She walked toward the doors. Holloway's voice stopped her one last time. The colonel is alive because you refused to follow protocol, because you refused to give up. That's not something to run from. Sam looked back over her shoulder. You fired me for the same reason. I was wrong. The words hung in the air. Holloway's face was pale, his eyes red. I was wrong, and I'm sorry. Sam held his gaze for a long moment. Then she pushed through the doors and disappeared into the hallway. Behind her, the colonel's monitor beeped steadily. His breathing grew stronger. His eyes opened, halfway, unfocused but aware. Torres leaned over him. Colonel, can you hear me? He nodded weakly. You're at Fort Carson Medical Center. You had a cardiac event, but you're stable now. His lips moved. Torres leaned closer. What was that, sir? His voice was barely a whisper. Who saved me? Torres glanced toward the empty doorway. Someone who knows what she's doing. Patterson stood beside Holloway, watching the colonel breathe. You need to bring her back. Holloway nodded slowly. I know. Not as a nurse. I know. She just did what most surgeons couldn't, in front of everyone, without hesitation. Holloway closed his eyes. I know. Outside, Sam stood in the parking lot again. The sun had set, the sky was dark. She looked at her hands under the streetlight, still steady. But this time, they were shaking, just slightly. She closed them into fists and walked toward her car. Behind her, inside the hospital, the colonel's heart kept beating. Sam sat in her car with the engine off. The parking lot was quiet, except for the distant hum of the hospital generator. Her hands rested on the steering wheel, still trembling slightly. She stared at them, willing them to stop. They didn't. She closed her eyes and breathed, in through the nose, out through the mouth, the way she'd been taught, the way she'd done 100 times in field tents with mortar fire shaking the ground. Her phone buzzed. She ignored it. It buzzed again. She pulled it from her pocket. 3 missed calls, 2 from a number she didn't recognize, 1 from Dr. Patterson. A text appeared. Patterson, please come back. We need to talk. This isn't over. Sam deleted it without responding. She turned the key. The engine started. Another text. Patterson, the colonel is asking for you. Sam's hand froze on the gear shift. She stared at the screen. Her phone rang. Patterson's name lit up the display. Sam hesitated, then answered. I'm done, Lynn. Patterson's voice was urgent, the calm. He's awake. Fully conscious, neurologically intact, no deficits. Do you understand what that means? It means he got lucky. No, it means you did the impossible. 14 minutes, Sam. Most people don't come back from that. And when they do, they're vegetables. He's talking. He's oriented. He remembers everything up until the collapse. Sam said nothing. Patterson continued. Holloway wants to see you. So does hospital administration. But more importantly, the colonel wants to thank the person who saved his life. Tell him it was a team effort. He knows better, Torres told him. Sam exhaled slowly. I can't come back. Why? Because this is what I left. This is what I walked away from. Making impossible saves? Making decisions that cost lives. Patterson's voice softened. Sam, I read the article. I know about Kandahar. But whatever happened there? You don't know anything. Sam ended the call. She put the car in reverse and backed out of the space. Her phone rang again. Different number this time. The hospital switchboard. She ignored it and drove toward the exit. Headlights appeared in her rearview mirror. A car pulled out behind her, following. Sam's eyes narrowed. She turned left out of the parking lot. The car followed. She drove 3 blocks, then pulled into a gas station. The car pulled in behind her. Dr. Patterson stepped out, still wearing her trauma gown. Sam got out of her car. Are you following me? Yes. That's not okay. Patterson walked closer. Neither is walking away from who you are. You don't know who I am. I know you just saved a man's life when everyone else, including me, thought it was over.
I know you have skills most trauma surgeons will never have. And I know you're running from something that wasn't your fault. Sam's jaw tightened. You read one article. Then tell me the rest. Sam looked away. Go back to the hospital, Lynn. Not without you. I'm not coming back. Patterson stepped closer, her voice quiet but firm. 18 months ago, you were leading a trauma team in Kandahar, forward operating base, mass casualty event. You had to make a choice. 3 local children or 2 American contractors. You chose the children. The contractors died. And the investigation buried you for it. Sam's hands curled into fists. The contractors were CIA operatives, embedded, off the books. When they died, someone had to take the fall. That someone was me. But you made the right call. Did I? 2 Americans dead. Their families never got answers. And I got to walk away with my license intact as long as I disappeared. Patterson shook her head. You were scapegoated. I made the choice. A choice any good surgeon would make. You triaged. The children were savable. The contractors weren't. Sam's voice rose. You weren't there. You didn't see their faces. You didn't hear them begging me to save their guys first. And you didn't sit through the hearing where they called me a traitor for prioritizing foreign nationals over Americans. Patterson's voice didn't waver. And tonight, you saved an American colonel when everyone else said it was hopeless. Does that make you a hero again? Or does it not count because he's not the right kind of patient? Sam's eyes flashed. That's not fair. None of this is fair. But you can't keep punishing yourself for doing your job. I left because I couldn't trust myself anymore. I couldn't look at a patient without seeing their face, without wondering if I was making the right call or just trying to prove something. Patterson stepped around to face her. And tonight, what were you trying to prove? Sam met her eyes. That I could still save someone. You did. One person in 18 months. One person who wouldn't be alive if you'd stayed in your car. Sam looked at the ground. Her hands were shaking again. Patterson's phone buzzed. She glanced at it, then held it up. It's the hospital. They want you to come back. Not as a nurse, as a physician. Sam shook her head. I can't. Why? Because what if I fail again? Patterson's voice was gentle. What if you don't? They stood in silence. The gas station fluorescent lights buzzed overhead. A car pulled in, filled up, and left. Patterson spoke again. The colonel asked me to give you a message. Sam looked up. He said, tell her I have 3 daughters and 5 grandchildren, and because of her, I get to see them again. Tell her that matters. Sam's eyes filled. She blinked hard, forcing the tears back. Patterson continued. He also said, tell her that whoever told her she made the wrong call in Kandahar was a coward, and she should stop listening to cowards. Sam's breath caught. He doesn't know what happened. Torres told him. She looked it up, found more than I did. She was in Kandahar. Different unit, but she heard the stories. She said everyone on the ground knew you made the right call. It was only the brass back home who had a problem with it. Sam wiped her eyes with the back of her hand. It doesn't change what happened. No, but it changes what happens next. Patterson's phone buzzed again. She answered, listened, then her face went pale. We're on our way. She hung up and looked at Sam. The colonel is crashing again. His heart is in V-fib. They're trying to stabilize him, but he's not responding. Sam's head snapped up. What happened? They don't know. He was stable, then suddenly collapsed. Holloway is with him now, but Sam was already moving. She got into her car, started the engine. Patterson ran to her own car. They drove back to the hospital, side by side, lights cutting through the darkness. Sam's hands weren't shaking anymore. Inside the trauma...
A bay. Alarm screamed. The colonel's body convulsed as the defibrillator discharged. Once, twice. The monitor showed chaotic rhythm, ventricular fibrillation, the heart quivering uselessly. Holloway stood at the bedside, sweat dripping down his face. Charge to 200. Clear. The shock delivered. The colonel's body arced. The monitor didn't change. Again, 250. Clear. Another shock. No change. Torres handed Holloway the epinephrine. He injected it. 30 seconds passed. The rhythm stayed chaotic. Garrett started compressions. Hard. Fast. But the colonel's color was fading. The automatic doors burst open. Sam strode in, Patterson right behind her. Holloway looked up. Reed, Sam didn't let him finish. She moved to the bedside, her eyes scanning the monitor, the IV lines, the med cart. How long has he been in VFib? 3 minutes. Epinephrine? 1 dose. Amiodarone? Holloway hesitated. Not yet. Sam looked at Torres. Get me 300 milligrams of amiodarone, now. Torres didn't hesitate. She grabbed the vial and handed it to Sam. Sam drew it up and pushed it through the IV line. Stop compressions. Garrett stopped. Everyone watched the monitor. The chaotic rhythm continued. Sam placed her hands on the colonel's chest, feeling for the heartbeat beneath the ribs. She closed her eyes, concentrating. There's a flutter. He's trying to convert. Holloway stared at her. How can you feel that? Sam didn't answer. She kept her hands on the colonel's chest. Charge the defib to 300. The nurse charged it. Sam took the paddles. Clear. She placed them precisely. One below the right clavicle, one at the left lateral chest wall. She pressed the button. The shock delivered. The colonel's body jerked. The monitor flatlined for 2 seconds. Then a blip appeared. Another. A rhythm. Sinus rhythm. The colonel's chest rose. His eyes fluttered. The room exhaled collectively. Sam handed the paddles back and stepped away. Holloway stared at her. You did it again. Sam's voice was quiet. We did it. The colonel's eyes opened fully. He looked around, disoriented, then focused on Sam. His voice was hoarse but clear. You. Sam nodded. Rest, Colonel. You're safe. He reached out weakly. She took his hand. Thank you. Sam squeezed his hand gently. Thank you for not giving up. His eyes closed, but his grip stayed firm for a moment before relaxing. Holloway approached slowly. Dr. Reed. Sam turned. He extended his hand. I'm sorry, for everything. And I'm asking you to stay, not as a nurse, as a trauma surgeon, lead position, full autonomy. Sam looked at his hand, then at his face. I'll think about it. She walked out of the trauma bay. This time, she didn't leave the building. She stood in the hallway, breathing, her hands steady again. Patterson joined her. You're staying. Sam nodded slowly. Maybe. Why maybe? Sam looked back through the glass at the colonel, stable now, surrounded by monitors that beeped in steady rhythm. Because I need to know I'm doing this for the right reasons. What are the right reasons? Sam smiled faintly. I'll let you know when I figure it out. Sam sat alone in the hospital chapel. The room was small, dimly lit by a single stained glass window that filtered streetlight into soft colors across the empty pews. She leaned forward, elbows on her knees, hands clasped loosely. She wasn't praying. She was thinking. The door opened quietly. Dr. Patterson stepped inside, paused when she saw Sam, then walked down the aisle and sat beside her. They sat in silence for a moment. Patterson spoke first. Holloway's meeting with administration right now. They want to offer you a formal position, chief of trauma surgery, your own team, your choice of residents. Sam didn't look up. That's a lot to offer someone who was suspended 6 hours ago. You saved 2 lives tonight, one of them twice, and you did it with skills nobody else in this hospital has. Sam leaned back against the pew. Skills I spent 8 years learning in places I'm trying to forget. Patterson turned toward her. Why did you really leave the military, Sam? Not the official reason, the real one. Sam was quiet for a long time. Then she spoke, her voice low and measured. Kandahar, Forward Operating Base Chapman, 18 months ago. We took mortar fire during a supply convoy. 3 local children were caught in the blast. A boy, maybe 8, 2 girls, younger. They were brought in with shrapnel wounds, severe bleeding, but savable. She paused, her jaw tightening. 2 minutes later, they brought in 2 contractors. Americans, private security. Same blast. Traumatic amputations, massive blood loss, compromised airways. I triaged. The children had better odds. So I assigned my best surgical team to them. Patterson listened without interrupting. Sam continued. The contractors died on the table, bled out before we could stabilize them. The children survived, all 3 of them. I thought I'd made the right call. Her voice hardened. Then I found out the contractors weren't just security. They were CIA, embedded operatives, off book. When they died, someone had to answer for it. That someone was me. Patterson shook her head. You made the medically correct decision. That's what I said at the hearing. I showed them the triage assessments, the blood loss calculations, the probability of survival. I did everything by the book. And they didn't care? They cared about optics. 2 Americans dead,
3 Afghan children. In their eyes, I'd chosen foreign nationals over our own people. They couldn't court-martial me without exposing the CIA connection, so they offered me a deal. Resign quietly, keep my license, disappear. She looked.
So I did. I disappeared. I found the smallest, quietest job I could, a nurse at a military hospital where nobody asks questions, and I told myself I'd never make a life or death decision again. Patterson's voice was gentle. But you did. Tonight. I didn't have a choice. You always have a choice. You chose to come back. You chose to fight for the colonel when everyone else stopped. Sam's eyes filled again. She blinked hard. What if I'm only good at this because I've seen so much death? What if the reason I can stay calm is because I've already lost the part of me that's supposed to feel? Patterson reached over and took Sam's hand. The fact that you're asking that question means you still feel plenty. The door opened again. Torres stepped inside, saw them, and hesitated. Sorry, I didn't mean to interrupt. Patterson waved her in. You're not. Come sit. Torres walked down the aisle and sat on the pew in front of them, turning to face Sam. I need to tell you something. Sam looked at her. Torres pulled out her phone and opened a document. After you left, I started digging. I was in Kandahar. Different fob, but we heard stories. About a surgeon who saved 3 kids during a mortar attack. About how she got railroaded for it. She handed Sam the phone. This is the after-action report, declassified 3 months ago. It was buried, but it's public now. Sam took the phone, her hands unsteady. She read the screen. Her eyes moved faster as she scanned the lines. Patterson leaned closer. What does it say? Sam's voice was barely audible. The contractors were already in shock when they arrived. Traumatic amputation of both femoral arteries. Blood loss estimated at over 60%. The report says... She paused, her throat tightening. The report says they were non-viable upon arrival. Any resources spent on them would have been futile. Torres nodded. You didn't kill them, Captain. They were already gone. You just didn't waste time pretending otherwise. Sam's hands shook as she held the phone. Why wasn't this in the original hearing? Because it was classified. The CIA didn't want it public that their operatives were in an unsecured zone. So they classified the real report and fed you a sanitized version that made it look like a judgment call. Sam stared at the screen, her vision blurring. I carried this for 18 months. I thought I killed them. Patterson's voice was firm. You didn't. You saved 3 children. And tonight, you saved a 58-year-old colonel. You've spent a year and a half punishing yourself for doing exactly what you were trained to do. Sam handed the phone back to Torres, her hands trembling. I don't know what to do with this. Torres leaned forward. You accept it. You stop running. And you let yourself be who you've always been. The door opened once more. This time it was Holloway. He stood at the entrance, his face drawn but sincere. Sam, can I speak with you? Patterson and Torres stood. We'll give you 2 some space, Patterson said. They walked past Holloway and out of the chapel. Holloway walked down the aisle and sat where Patterson had been. He didn't speak immediately. When he did, his voice was quiet. I owe you more than an apology. I owe you the truth. Sam looked at him. Holloway continued. I was a captain in the Army Medical Corps 15 years ago. I did 1 deployment, Germany. Never saw combat, never saw anything like what you've seen. When I got out, I told everyone I was a veteran. I let them assume I'd been in the field, that I'd earned my authority. He looked down at his hands, but I hadn't. And when you walked in here with your skills, your calm, your precision, I saw everything I wasn't, everything I'd pretended to be, and I resented you for it. Sam's voice was steady. So you tried to keep me in my place? Yes, and I was wrong. You're not a nurse. You're not even just a surgeon. You're the kind of doctor I always wanted to be, but never had the courage to become. He met her eyes. The hospital administrator wants to offer you chief of trauma surgery. I told them I'd step down to make room for you. It's your position if you want it. Sam shook her head. I don't want your position. Holloway's face fell. Then what do you want? Sam stood and walked to the window, looking out at the parking lot.
I want to stop hiding. I want to teach. I want to train people to do what I do. So the next time there's a mass casualty event, more than one person knows how to handle it. She turned back to him. I'll take a position here, but not as chief. As lead trauma surgeon with a mandate to develop a training program, combat medicine for civilian applications, open to residents, nurses, paramedics, anyone who wants to learn. Holloway stood. I'll make it happen. And I want Torres in medical school, full ride. She's got the instincts. Holloway nodded. Done. Sam extended her hand. Then I accept. Holloway shook it, relief flooding his face. Thank you. Don't thank me yet. I'm going to push this staff harder than they've ever been pushed. Holloway smiled faintly. I'd expect nothing less. He left the chapel. Sam stood alone again, staring at the stained glass. Her phone buzzed. A text from an unknown number. This is Colonel Bridger. They told me you're staying. Thank you. My family thanks you. And for what it's worth, whoever told you that you made the wrong call in Kandahar was a damn fool. You saved my life by refusing to give up. That's what real doctors do. Sam read the message 3 times. Then she typed a response. Thank you, Colonel. See you in recovery. She pocketed her phone and walked out of the chapel. Patterson and Torres were waiting in the hall.
Low away. So? Patterson asked. Sam smiled. Small, but real. I'm staying. Torres grinned. Good, because I just signed up for your first training session. Sam laughed quietly. It hasn't even been approved yet. It will be, and I'm not missing it. Patterson put a hand on Sam's shoulder. Welcome back, Dr. Reed. Sam nodded. It's good to be back. They walked together down the hallway, past the trauma bay where the colonel slept peacefully, his monitor beeping in steady rhythm. Sam glanced through the glass. His daughters had arrived. 3 women in their 20s and 30s, sitting beside his bed, holding his hands. One of them looked up and saw Sam. She mouthed 2 words. Thank you. Sam nodded and kept walking. For the first time in 18 months, her hands were steady, her breathing was calm, and she knew exactly where she belonged. 3 months later, the Fort Carson Medical Center conference room was standing room only. Residents lined the walls, nurses filled the back rows, paramedics from 3 counties sat in folding chairs brought in to handle the overflow. At the front of the room, a projector displayed a single slide. Combat Medicine for Civilian Applications. Instructor, Dr. Samantha Reed, MD. Sam stood beside the screen, wearing surgical scrubs and a white coat with her name embroidered on the chest. Her hair was pulled back, and her hands rested calmly at her sides. She waited for the room to settle before speaking. Good morning. My name is Dr. Samantha Reed. 8 years ago, I was deployed to Afghanistan as a trauma surgeon with special operations. I performed over 800 combat surgeries in field conditions. I learned to make life or death decisions in seconds. I learned to work with limited resources, no backup, and constant chaos. She paused, scanning the room. I also learned that the difference between someone living and dying often comes down to one person refusing to give up. That's what this program is about. Not heroics, not protocol, persistence. A hand went up in the 3rd row, a young resident, 1st year, nervous. Dr. Reed, how do you teach persistence? Sam smiled faintly. You don't teach it, you model it. You show people what's possible when you don't stop. And then you give them the skills to do it themselves. She clicked to the next slide, a diagram of the human heart. We're going to start with pericardiocentesis. How many of you have performed one? 3 hands went up out of 50 people. How many of you have seen one? 10 more hands. How many of you would feel confident performing one in an emergency without supervision? The hands went down. The room was silent. Sam nodded. That's why you're here. By the end of this program, every one of you will have performed this procedure on a simulator until you can do it in your sleep. Because the next time someone's heart is drowning in its own fluid, I want you to be the person who steps forward, not the person who freezes. She clicked to the next slide, a photo of a field hospital tent, dirt floor, canvas walls, soldiers working over a stretcher. This is where I learned. You're learning in a state-of-the-art facility with every resource available. You have no excuse not to master this. Another hand, a paramedic in the back.
Dr. Reed, what if we make a mistake? Sam's voice was steady. You will. Everyone does. The question is whether you learn from it or let it stop you. I've made mistakes that cost lives. I've also made decisions that saved lives when everyone else said it was impossible. The difference wasn't skill. It was refusing to let fear make the decision for me. She clicked to the next slide, a list of procedures. Emergency cricothyrotomy, needle decompression, chest tube placement, massive transfusion protocol, damage control surgery. These are the core skills. You'll rotate through each station. You'll practice until your hands remember the movements without thinking, and then you'll practice more. The door at the back opened. Dr. Holloway stepped in, followed by Dr. Patterson and Sergeant Maya Torres, now wearing a white coat with a medical student badge clipped to the pocket. Sam glanced at them and nodded. Holloway took a seat in the back row. Patterson sat beside him. Torres moved to the front and stood next to Sam. Sam gestured toward her. This is Maya Torres, former Army medic, current second-year medical student, and your lead teaching assistant. She's been where you haven't. She's seen what you'll hopefully never see, and she's going to make sure you're ready if you do. Torres addressed the room. I was in Kandahar when Dr. Reed saved 3 children during a mortar attack. I wasn't there, but I heard the story. Everyone did. She made a call that ended her military career because she chose to save the patients who had the best chance. She's been carrying that weight for 18 months. Torres looked at Sam. 3 months ago, I watched her bring a man back from 14 minutes of cardiac arrest. I watched her refuse to give up when everyone else, including the attending physician, said it was over. That's the standard she's setting, and that's the standard we're going to meet. The room was silent. 50 sets of eyes focused on Sam. Sam spoke again. Let's get to work. The group split into stations. Sam moved between them, observing, correcting, guiding. At the pericardiocentesis station, a resident hesitated before inserting the needle into the simulator. Sam stepped beside him. What's stopping you? I'm afraid I'll go too deep. Then go slow. Feel the resistance. The needle will tell you when you're there. She placed her hand over his, guiding the angle. 30 degrees toward the left shoulder. Steady pressure, don't force.
The needle advanced. The simulator beeped as the tip entered the pericardial sac. Simulated fluid filled the syringe. The resident exhaled. I did it. Sam nodded. Now do it again, and again, until you don't need me standing here. At the airway station, a nurse struggled with the cricothyrotomy model. Her hands shook as she positioned the scalpel. Sam knelt beside her. Breathe. Your patient isn't dying faster because you're nervous. Take your time. But in a real emergency, panic kills. Calm saves. Find the landmark, make the incision, trust your training. The nurse steadied her hands and made the cut. Clean, controlled. She inserted the tube and secured it. Sam smiled. Perfect. That's the one that saves a life. The training continued for 3 hours. By the end, every participant had successfully completed at least 2 procedures. The room buzzed with quiet confidence. Sam stood at the front again. This is day 1. You're going to come back next week and do it again, and the week after that, and the month after that, because competence isn't a destination, it's a practice. A hand went up, the same first-year resident from earlier. Dr. Reed, do you still get nervous? Sam considered the question. Yes, every time. But I've learned that nervousness means I care, and caring means I'll do everything I can to get it right. So I let the nervousness sharpen my focus instead of freezing my hands. She looked around the room. You're dismissed. See you next week. The crowd filed out slowly, many stopping to thank Sam or ask follow-up questions. Torres stayed behind, helping pack up the simulation equipment. Holloway approached. That was remarkable. Sam shrugged. It's a start. The hospital administrator called me this morning. FEMA reached out. They want to observe your program. If it works here, they want to implement it nationally. Sam paused, holding a simulator case. Nationally? Trauma centers across the country. Your curriculum, your methods. Patterson joined them. The Department of Defense is interested too. They want you to design a combat-to-civilian transition program for retiring military medical personnel. Sam set the case down and leaned against the table. That's a lot. It's what you're good at, Patterson said.
teaching people to do what you do. Sam looked at Torres. What do you think? Torres smiled. I think you spent 18 months hiding. Maybe it's time to stop. Sam nodded slowly. Maybe it is. 1 week later, Sam stood in the recovery wing. Colonel Bridger sat in a chair beside his bed, dressed in a hospital gown but looking stronger. His color was good, his breathing steady. His 3 daughters surrounded him, laughing at something he'd said. He saw Sam and waved her over. Dr. Reed, come meet my family. Sam approached. The daughters stood, and the oldest extended her hand. I'm Rebecca. This is Anne and Jessica. We can't thank you enough. Sam shook each of their hands. Your father's a fighter. He did most of the work. Colonel Bridger snorted. I was dead. You brought me back. You weren't ready to go. He smiled. No, I wasn't. I have too much left to do. He reached into his pocket and pulled out a photograph. It showed him surrounded by 5 small children, all smiling. My grandkids. I'm supposed to teach the oldest one to fish next month. Because of you, I get to. Sam took the photo, studied it, then handed it back. That's worth fighting for. He nodded. It is. And so is what you're doing. I heard about your program, about FEMA and the DoD. You're going to save a lot of lives, Doctor. Sam's voice was quiet. I hope so. He stood slowly, steadying himself with one hand on the chair. You already have. And not just mine. You saved yourself, too. Sam met his eyes. He extended his hand. She shook it. Thank you, Colonel. Thank you, Captain. She left the room and walked down the hallway. Through the window, she could see the parking lot where she'd stood 3 months ago, ready to leave forever. Her phone buzzed. A message from an unknown number. Dr. Reed, this is Lieutenant Colonel David Chen, your former CO. I heard you're back in medicine. I always knew you would be. The Army lost a great surgeon, but it sounds like the civilian world gained one. Stay strong. You made the right call in Kandahar. Don't ever doubt that. Sam read the message twice, then pocketed her phone. Patterson appeared beside her. You okay? Sam nodded. Yeah, I am. Good, because we have another training session in an hour, and Torres just told me we have 15 new sign-ups. Sam smiled. Then let's get to work. They walked together down the hallway. Behind them, the hospital hummed with life. Monitors beeped, voices called out, gurneys rolled past. And in the trauma bay, a new patient arrived. Critical, unstable. The kind of case that required everything Sam had learned in 8 years of war and 18 months of hiding. The intercom crackled. Dr. Reed to Trauma 1. Dr. Reed to Trauma 1. Sam's stride didn't break. She pushed through the doors, her hands already reaching for gloves. Patterson followed. Torres was already inside, prepping the bed. The patient was coding. The monitor screamed. The team looked at Sam. She stepped forward, her voice calm and clear. Let's go to work. Her hands moved, steady, precise, confident, because she was exactly where she was meant to be. And this time, she wasn't hiding. She was home. The monitor beeped. Once, twice. Steady. The patient stabilized. The room exhaled. And Sam kept working. Because that's what she did. That's who she was. Dr. Samantha Reed, trauma surgeon, teacher, survivor. And she was just getting started.